Today I'm going to be talking about kidney transplants. Okay, so who gets one and how do they know they need it? Basically, anybody can get a kidney transplant as long as they are healthy enough. People must be cancer and infection free to get one. If their kidneys start to fail, there are two methods of treatment: dialysis and kidney transplants. The need for a transplant comes from infected or failing kidneys. Basically, all a kidney transplant is putting a new, healthy kidney into your body to do the work that your kidneys no longer can. Doctors prefer transplants over dialysis because transplant patients tend to live longer. The kidneys remove urea and liquid waste from blood, which is urine. They balance substances in blood, regulate blood pressure, produce a hormone that helps create red blood cells. Without healthy kidneys, your blood will build up with waste and won't be chemically balanced. If it's left untreated, it could end in death. A kidney transplant is needed when someone's kidneys start to fail, if there's obstructions of the kidney, congenital defects, diabetes, high blood pressure, or infections and inflammation. The kidneys are located in the upper abdomen, so the kidney transplant is in the abdominal cavity. The procedure. An IV will be started in your arm or hand, and more catheters may be put in your neck or wrist to monitor the status of your heart and blood pressure and take blood samples. If the surgical site is too hairy, then it will be shaved. A urinary catheter will be inserted into your bladder, and you will lie on your back on a surgical table. The surgery will be performed while you are asleep under general anesthesia. A ventilator tube will be inserted through your mouth and into your lungs. It will breathe for you during the procedure. The anesthesiologist will closely monitor all of your vitals during surgery. The surgical site will be cleaned with an antiseptic solution, and then the surgeon will make a long incision into the lower abdomen on one side. The donor kidney will be closely inspected before put in to make sure that it's healthy. The donor kidney will be placed into the belly. A left donor kidney will be put on your right side, and a right donor kidney will be put on your left side. This allows the ureter to be easily accessed for connection to your bladder. The renal artery and vein of the donor kidney will be sewn to the external iliac artery and vein. After the artery and vein are attached, the blood flow through these vessels will be checked for bleeding at the suture lines. The donor ureter, the tube that drains urine from the kidney, will be connected to your bladder. The incision will be closed with stitches or surgical staples. A drain may be placed in the incision site to reduce swelling, and then it will be bandaged and monitored. How to get a transplant. In order to be considered for a kidney transplant, you have to be healthy. You cannot have any of these: a recurring infection, cancer, severe heart problems, or other severe health problems. You also have to be put on the donor list, which could end up being 5 or more years to get a donor. Other options are testing family members or friends to see if they are matched. The more the new kidney matches with your body, the less chance of kidney rejection. Risks. Some of the risks are bleeding, infections, blockage of the vessels, leakage or blockage of urine, and lack of function of the new kidney. A major risk with a kidney transplant is kidney rejection. Rejection is a normal response of the body to new tissue. The immune system reacts and attacks the new organ because it thinks it's a threat to the body. In order for the organ to survive, medicines have to be taken to trick the immune system. So, Brendan Connor says that he feels so much freer now and will soon be able to do almost anything he wants. He's excited to play basketball again and move forward in his career. And Jennifer Branch feels like she doesn't have a kidney disease and that she's able to do everything she wants: work, exercise, travel, and she can live a very long and happy life. According to these two people, kidney transplants changed their lives for the better and made them happier, healthier, and loving life more. And that's why you should get one.